beautiful ladies, I am Grace and welcome to the live. And today I would like to share with you about an update of my second pregnancy and how I am doing as well with preventing from diastasis recti. So for the people who don't know me, let me briefly introduce my background. So I am Grace, the founder of Honest Bellies, and I went through a really tough journey of healing diastasis recti post my first pregnancy. So after my first child was born, I was diagnosed of over 10 finger gap on my abdominal muscles, and it was horrible. I was also being offered with different advice, different opinions from doctors and physio specialists, and I was even offered option to go through a surgery after I am done with having kids. And through about a year or even a year and a half journey of transforming my muscles, I also was undergoing a lot of uncertainty and suspicions from people, not knowing what kind of result I would get and not knowing whether I would be able to close my gap at all. But I was very happy that after all the persistency and doing all the right things, I was able to eventually close my over 10 finger tummy gap, and my tummy looked like as if I didn't pregnant before. And right now I am 31 week pregnant with my second child, and this time I am doing a lot of things differently, and I'm consciously just working on my core to prevent the diastasis recti to come back again. I know it's not totally possible to kind of completely heal it during second pregnancy, because it's quite normal for the gap to be reopened again when you have multiple pregnancies. But what I'm doing is to try to prevent as much as I can. And because I have gone through it once, and right now I have the confidence that even if the diastasis will be reopened again, I would be able to close it after my second child is born. It's just a matter of time, it's a matter of effort. And so today I want to give you an update. I want to do mainly two things. So the first one is I want to show you my tummy and also to check diastasis to see how many finger gaps I have right now. And I want to also, secondly, to demonstrate to you how it looks like when you have a diastasis. So the first one is I want to check how many gaps I have right now. So I just checked yesterday. I have right now about 3.5 fingers in between my abdominal muscles, the rectus abdominis. Compared to my first pregnancy, in which I had over 10 finger gap, right now I am already making a huge progress, which I'm very happy about. And the second is I want to demonstrate to you how it looks like. I want to kind of just mention that different women may have different kind of forms of diastasis recti, and there are different variations as well. So for some moms, the opening of the abdominal muscles and the thinning of the deep connective tissue, the linea alba, is mainly around the belly button area, this area. And however, there are other women, other moms who are experiencing different variations. For example, some might have open all the way from the sternum down to below belly button. And also some may have more above the belly button area and less below belly button area. And in my case, after my first pregnancy, my gap, the thinning of the linea alba or the abdominal muscle gap, is mainly around the belly button area. I remember at that time I had a huge protruding kind of bulge, like a donut shape, but it's much bigger than donut. It's like twice the size of a donut. The diameter is like probably 5 inches or more. It's like this. When I look at the mirror, it's like horrible. I can see a big bulge around my belly button area. That was how bad it was around that time. But I've also seen other women, especially the moms who used to be really, really athletic, who were doing a lot of exercises, core exercises before, and they were not aware of diastasis. And I've seen people experiencing full open from the sternum all the way up here and down here. And how you can detect it is when you're engaging your core or when you're adding the force. So if you lie down and let me double try. And if you raise up your head, for these women, they will be able to see a dome shape all the way from the sternum down to belly button or even below the belly button. I will make sure I put some pictures here so you will be able to see what it looks like. And another way is you can also take a look at the surrounding area. So let me just get closer. If you look at my belly, my tummy right now, you will be able to see, especially if you look from above down, you will be able to see two small bulge in this area. So one is about 1.5 centimeter to the left of my belly button, and the other one is here. It's about 1.5 centimeter to the right side of my belly button. So these are where my abdominal muscles are right now. So you see there's a thinning of the leaning elbow in between. And that's just by checking, by looking at it. But luckily, I don't have a full open above or below, which I can show you. Because when I lie down, make sure you lie from the side, right? And just raise your head, raise my head. You don't see any bulge in this area or down below the belly button area. So it's quite flat here. And then when I press, I change my hand. When I press here, it's all quite firm, which is a really, really good sign, because meaning that my abdominal muscles are still quite firm and close together, starting from about kind of 1 inch above my belly button area. So right now, let me also measure how many finger gaps I have. I will again slightly raise your head, the head. Don't raise too much, right? Just a little bit. And then put my fingers first just in the belly button area to feel the gap. I can feel my muscle is here. The other one is here. So roughly 3 fingers. Then I move it up. I can feel the closing of the muscle is roughly here. It's probably 1 inch above. I can feel the closing because it becomes much firmer above. And also below, I can feel the closing probably also here, which is 1 inch below. So the main gap right now is around my belly button area, and the diameter of the little circle, the little bulge, is probably 2 inches. So 1 inch above my belly button and 1 inch below my belly button. And the width of the gap just in the belly button area, it's about 3.5 fingers. So let me raise it up. So again, compared to my first pregnancy, I am doing so much better, because I remembered during my first pregnancy, the diameter of the bulge is about like this big, and right now it's about this small, right? But again, I am still have a few more weeks to go. Right now I'm 31 weeks pregnant, so the gap might become bigger, but I am still doing much better than my first pregnancy. And I am also more confident that because of I'm doing all the right things, I have so much knowledge and experience right now, I will be able to close my gap much more quickly. I really appreciate you watching the video and taking the time, and I hope that you find this video useful in either helping you to identify if you have diastasis recti during pregnancy or to measure it. And also just one kind reminder, do not perform this diastasis check very often, especially during pregnancy. First of all, your body is already undergoing so much pressure. You don't want to create additional pressure, and any crunches is bad. Even raising your head, you should try to minimize that. And secondly, it is quite normal because there's so much going on in your tummy. It's quite normal that you may not be able to feel the gap very accurately. And the width is easier to feel, but the depths, how deep the gap is, it's much more difficult. For me, it's almost impossible to feel how deep it is while I am pregnant. So don't even expect to measure the depth. If you just feel vaguely about the width, I think it's already very, very good. And thirdly, just don't be too anxious if the gap is being opened. And no matter how many pregnancies you've had, it is quite normal for you to have some form of diastasis recti. Actually, most of women experience that during pregnancy. It's a natural process. It's your body creating room for your tummy, for your baby to grow. So there's really nothing to worry about it. But the things we can do is do the right things, do the right exercises that will help us to prevent as much as we can from having severe diastasis recti postnatally. Okay, again, love from me. Oh, right, I forgot to mention there are two more things. One is that just below this video, I am going to attach a worksheet which summarizes 3 things that I have done to really help me to prevent from and heal diastasis recti. I hope you will find it helpful. And I've also attached another material which I developed, which is to help pregnant women to prevent from diastasis recti during pregnancy. It lists the things that you should not do, and also listed the effective exercise that you could do to prevent from diastasis during pregnancy. And I hope really you find these 2 materials helpful, and let me know how you're getting on with it. Let me know what kind of questions or comments you may have, and I very much look forward to hearing from you. And love from me, and I will see you in the next video. Bye!